much. Thanks for being here. Next, I'd like to invite Chris Gaal to come up and to talk a little bit about the history of this community's kind of trek toward nurse-family partnership. Would you like to?
Yeah. As prosecutor, I participate in the Child Fatality Review Team, and that's a multidisciplinary team that includes people from law enforcement, from the Department of Child Services, from the school district, the coroner, the health department, social service agencies that serve children, CASA, medical people. There's a physician on that, in that group. And the mission of that group is to review child deaths and to evaluate if that death was preventable. Make recommendations about what could have been done to prevent similar injuries or deaths in the future. Several years ago, we were having a meeting, and at the end of the meeting, I started talking about a program that I had recently learned about from a public safety group. I was on their email list, and they sent me some information. I started reading about it. It was a program that teamed up a new mother living in poverty with a nurse from pregnancy through the first 2 years of that child's life. And I've been reading about this program, and it made a big impression on me. It was an incredibly effective public safety program, according to the research that had been done and the data that had been gathered. Also at that meeting was Dana Waters, who is here. Dana? And who was at that time the Director of Women's Health Services at IU Health Bloomington Hospital. And this conversation also sparked her interest, and it just so happened she had also gone recently to a training where she heard some incredibly impressive research presented by a doctor who had studied a public health program that provided nurses to new mothers living in poverty. And we went back and forth for a while about how great each of these programs were that we had heard of, and each one of us was kind of vying for whose program was better, the public safety one or the public health one. And after a while, we realized that we were in fact talking about the exact same program, the Nurse-Family Partnership Program. We didn't realize at first that it was the same program because we were both coming at it from different perspectives. I was coming at it from the perspective of a prosecutor concerned with public safety, and she was coming at it from the perspective of a healthcare person concerned with patient outcomes and public health measurements. But it was the same program. And that's one of the things that is so impressive about the Nurse-Family Partnership Program, is that it represents such a broad range of benefits, including categories of health, economic stability, and public safety. But more than that, it's been studied for 4 decades in randomized, scientifically controlled research trials in different types of communities with different social and racial backgrounds. And those benefits have consistently been documented by the research, and they're supported by solid evidence that if you follow this model, the benefits are real. And even though it's an intervention in the earliest stages of life, the first 2 years of a child's life and development, the positive effects last well into later years of life and have positive benefits both for the individual child and the mother, and indeed the whole community. And we knew this was a good idea. We just needed to find a way to make it happen. So we pushed forward. We invited everyone we could think of who might be interested to a stakeholder meeting that we held at the library, and we started talking this idea up. And we asked people, doesn't this sound like a good idea? Doesn't this sound like something that we should try and do here? Wouldn't you like to help try and make this happen? And we got a lot of people involved, and we had lots of meetings. We met with local, state, and local elected officials. We kept pushing. We looked for funding sources, looking for a grant. That was the main obstacle. The community will was there, but there wasn't the way. The funding was not available. And I just want to acknowledge some of the people who have been involved with this along the way. Nancy Hughes from Family Solutions, who is the chair of our local Child Fatality Review Team. A lot of people from IU Health Bloomington Hospital, IU Health Community Health, Dana Waters, Anna Wygand, Amy Meek, Carrie Shabarami, Tara Green, Carol Weiss-Kennedy, many people from DCS, their directors Harmony Gist and Elizabeth Bullock, Kristen Deshay from CASA, Dr. Richard Malone, pediatrician with Southern Indiana Physicians, State Representatives Matt Pierce and Senator Mark Stoops. We met with both of them, and many others that we met with along the way. I'd like to thank all the people who've been involved with this for believing in the idea and helping to push it forward. But I really want to say this. I want to answer another question, which is, why should a prosecutor care about a program like this? I have been the elected prosecutor in this community for 11 years now, and before that I spent about a decade in private practice doing primarily criminal defense. And something that I have noticed in my experience is that I recognize the names of the families. I see that my office now prosecutes the children of the parents that I defended when I was in private practice. And over time, those kids have grown up and they've repeated some of the same patterns of problem behaviors that got their parents into trouble and that now are getting them into trouble. And these are families that have often lived in a structural pattern of poverty that has repeated from generation to generation, often going back even further to previous generations. And we often think of the criminal justice system as focused on punishment. Although over time in Monroe County, we've embraced a more progressive focus on rehabilitation, including problem-solving courts, drug and alcohol addictions treatment, mental health treatment, to try and address the issues that often underlie problem behaviors that lead people to get into trouble and to become entangled with the criminal justice system in the first place. And we do that in this community because we recognize that in order to be successful in addressing the problem behaviors, that we have to address those underlying issues that are often rooted in poverty. People need to be able to meet their basic needs. And people need health care, they need education, and they need economic stability, a job. And when people don't or can't participate economically, when they're left out, when they're left behind, when they don't have a stake in the community, then they are more likely to be at risk for drug and alcohol addictions, poor mental and physical health, dropping out of school, unemployment, reliance on public assistance, involvement with the criminal justice system, and a whole range of other social problems that are often deeply rooted in poverty. And in other words, they're more likely to get into trouble and often as repeat offenders. We see this in the opioid crisis, which has resulted in a significant rise in the number of children in need of services, or CHINS cases, not only in Monroe County court system, but throughout the entire state of Indiana. And this is often referred to as a parenting crisis in Indiana that goes hand in hand with the opioid crisis in our state. The criminal justice system here and everywhere else in Indiana expends vast amounts of time and resources on repeat offenders who get caught up in a cycle of recidivism, committing low-level offenses again and again, costing the community and undermining public safety. How do we address those difficult issues deeply rooted in poverty? How do we change that pattern? How do we break that cycle? That is what I love about the nurse-family partnership idea. It takes a step in that direction, and it achieves real results. But even more than that, it shows us that there is a different direction that exists, and it points us in that direction. It points us in the direction of how we can reprioritize our community to meet human needs, and in the process, not only improve the life of an individual child and an individual mother, but also improve the whole community. So as a prosecutor concerned with public safety in my community, this is what impresses me about the program. A 48% reduction in child abuse and neglect, 39% fewer injuries, a 56% reduction in emergency room visits for accidents and poisonings, a 59% reduction in child arrests at age 15, 61% fewer arrests, and 72% fewer convictions of the mother. Those are just some of the benefits related to public safety, and there are other benefits that include obviously reduced infant mortality, improved child health and development, improved school readiness, greater employment of the mothers, increased father presence and partner stability, an 82% increase in months employed by the mother, a 67% reduction in behavioral and intellectual problems for the child at age 6. This program is a cost-effective, long-term investment in the future based on the idea of prevention. And as I always say, an ounce of prevention is worth a pound of cure. Prevention saves money that might otherwise have to be spent in the future on problems that just get bigger and more expensive over time. The Nurse-Family Partnership Program reduces dependence on government assistance. It saves criminal justice resources by preventing crime because it breaks the cycle of repeat offenders that drive up costs in the criminal justice system. There was an independent study of the Nurse-Family Partnership Program by RAND Corporation several years ago that found that it provides a return of $5 for every $1 spent on the program. Now there's a new study that shows that that return is $6.20. These are all impressive results. But you don't just get these kind of results overnight. It takes time, and it requires us as a community to have a long-term vision for the future and be willing to make that investment. And there's an amazing thing that happens when you invest in children at the very beginning of their lives. You get results. I want to just end with a quote from Dr. David Olds, who is the founder of Nurse-Family Partnership Program. Dr. Olds puts it this way, quote, "There's a magic window during pregnancy. It's a time when the desire to be a good mother and raise a healthy, happy child creates motivation to overcome incredible obstacles, including poverty, instability, or abuse, with the help of a well-trained nurse." That's what this program is about, and that's why I say, if you want to improve public safety over the long term, if you want a strong community, if you want a strong future, invest in kids. That's what we're doing now. That's what we're here today to celebrate, because our community is doing something new. With the help of funding through the State Department of Health, we are able to create a new resource that we did not have before, and that I believe this new public health investment will make a real difference in people's lives. So I want to congratulate IU Health, Community Health, for sticking with the idea, continuing to go after funding, and finally being awarded this grant and making the Nurse-Family Partnership idea into a reality. It will be a much needed new resource to prevent problems and strengthen the local community and indeed the whole surrounding region. So let's keep working together and make this a success. I'm very pleased to serve on the Community Advisory Board for this program, and I look forward to seeing it have a big impact for many years to come. Thank you.